Good morning, everyone. Welcome. Thank you for coming. I'm Kim Patton. I'm the President and CEO of HealthSource of Ohio, and I have the pleasure this morning of introducing the governor. So thank you, Governor, for coming down to Claremont County. He is here to make a very important announcement that will change the lives of families in our Appalachian community. So it is my honor to introduce Governor Mike DeWine.
Hi, everybody. Kim, thank you for the good work you and HealthSource clinics do. We appreciate it very, very much. You know, when we talk about education, educating our young people, one of the things that is so very important is their health. Pretty difficult to learn if you have a toothache, difficult to learn if you don't have eye care, if you don't have the glasses, if you need them. And so improving the health of our children is just an essential part of what we're trying to do in Ohio in regard to education. And our goal, I think our common goal, is for every child to be able to live up to their God-given potential. And so the announcements that we're going to make today really directly relate, I think, to that, specifically with two of our school districts in this part of the state, one in Claremont County, one in Brown County. This is the fourth stop on a two-day tour we started on Friday, where we're making announcements about grants going to Appalachian communities. The effort started about 2 years ago when we made a commitment, our administration made a commitment to make long overdue comprehensive investments in our 32 Appalachian counties. The General Assembly understood the vision, delivered it really in a big way with House Bill 377, which I signed on June 28th, 2022. I want to thank Jean Schmidt, who is here. Jeannie, thank you very much, and she'll be up here in a moment. Also Adam Byrd, Senator Terry Johnson, and the other members of the General Assembly who were able to take the lead and pass this bill. We call this the Appalachian Community Grant Program, and we basically set aside $500 million to go to our Appalachian communities. But what is different about this, not only the size, but what is really different also is that we felt, and I feel very strongly, that these decisions about how to spend this money should not be made in Columbus. They frankly should be made by the local communities. And so we established a process where the communities could come together. Sometimes many communities come together to come up with ideas that would be transformative. And we got a ton of great ideas coming back. What we're announcing today and what we announced on Friday is the first of 3 tranches of this money. This is what we're announcing is over $60 million in this first wave, and all this will be used really for relationships between schools and healthcare. Many times we have clinics that are in our schools. They're doing a phenomenal job. This will, in some cases, start a new clinic in a new school where they've never had one, or in the case of our schools today, really expand the ability of that clinic to reach more kids. The other thing that we have found as we've looked around Ohio and see what works is that our schools are really our most trusted place. Our public schools are places where the community gathers. My wife Fran and I live in a small school district, Cedar Cliff School District, 650 kids. It's the place where everybody goes on Friday night for football, or you go for Saturday night, or during the week for something else. You go to plays. It's the place that comes together for the community. And so again, if you look at all the different applications and the grants that we're awarding, so many of them are actually based on that concept, that the school is really the place where people are comfortable. And so the goal is not only to improve the health of our children, but it's also to improve the health of the community as a whole. And you'll hear more about this in just a moment. So today we're here to make two grants that total $7 million. It will go through HealthSource of Ohio to expand their community health clinics in Claremont and in Brown counties. HealthSource has school-based health centers in both Goshen and Western Brown local schools, and these grants will not only improve that care but also provide new opportunities for students at the clinic. Let me start with Goshen Township local schools. This is a $3.4 million grant will help fund an expansion of HealthSource of Ohio at Loveland, which will increase access to primary care doctors and dentists and offer space for workforce development and job training programs, particularly in the medical fields. Again, latter part of that, one of the challenges that we face in Appalachia and other places in Ohio is we don't have enough people in the medical field. We need more people, and so we have to grow our own, and this is certainly an effort to do that. Second, a $3.6 million grant will help fund an expansion of HealthSource of Ohio's Mount Orab to increase access to primary and dental care and to create a workforce training program for medical and dental support positions. As I said, these grants are part of a larger $64.2 million investment that we are calling the Appalachian Children's Health Initiative, Appalachian Children's Health Initiative. Through the initiative, we are awarding grants to schools and community health projects in 36 different communities. So I will be at two other locations today making those announcements as well. The projects involve 16 healthcare partners and will serve more than 61,000 students total and 375,000 residents. Today's funding announcement includes also some of your neighbors. Let me just list some of those. Adams County. The Adams County Regional Medical Center will receive $1.3 million to implement a telehealth program for the Adams County, Ohio Valley School District and to establish a mobile health clinic to serve the Amish community. Two of the models that really work very well are the two I just talked about, and that is telehealth. One of the things that we learned during the pandemic is telehealth actually works, and it's a way to reach people particularly in our rural areas, particularly when we're dealing with specialists who they might not be able to have access to or not easily have access to. The other, of course, is the mobile clinics. The mobile clinics work exceedingly well. In addition to Adams County, we have Fairfield Local School District and Highland County will receive $3.2 million to build a school-based health clinic to offer telehealth, primary and behavioral health care through Highland Health Partners. Classroom space will also be added to support workforce development and STEM education. So those are today's announcements. I want to commend Randy Leidy and the Appalachian Children's Coalition. They've worked with us on this. I also want to introduce John Carey, who heads up our Appalachian. John, where's John? Somewhere. John's always in back. There you are, John. His team with the Governor's Office, Appalachia, who've been heavily involved in putting this together. And we're now going to hear a little bit from the medical point of view, and then we'll hear from our two school districts, and then Gene Schmidt will be our closer. So, thank you.
Good morning again. First of all, I want to thank everybody for attending. I know asking people to be someplace on a Monday morning is always a little iffy, but I would also especially like to thank a couple folks. One is Randy Leidy from the Appalachian Children's Coalition, and secondly are the folks from Nationwide Children's Hospital in Columbus. Thank you for including HealthSource in your Investing in Appalachia School and Community Health, a statewide strategy to build a better future for all project. We are so very grateful. And we're honored to be part of this award, which aims to support children through healthcare delivery as well as workforce development in healthcare. As many of you know, HealthSource of Ohio is the state's largest federally qualified health center, and we see over 61,000 patients annually in the Southwest area. Our mission is to provide exceptional health care to everybody in our community, but particularly to be passionate advocates for those who need us the most. Quality health care should be available to everybody, no matter where you live. This is why we're so excited about this award. Specifically, this project will allow us to expand 2 current centers in Goshen Township in Mount Orb. The Goshen Township will expand the facility 8,000 square feet, which is going to allow us to add 15 new exam rooms, but more importantly, dedicated space for a training center. We will increase access to medical and to behavioral health care, which is integrated for us and is done both in person and by telehealth. And it will strengthen our relationship with our school-based health program at the Goshen schools. That school district has been a wonderful partner, and we're very much looking forward to expanding that relationship. Not only are we committed to delivering health care, we also want to play a very important part for students to go to have futures in health care as their career. Since the pandemic, it has been very difficult to find healthcare workers. If you do not know, every healthcare institution in this state has this problem right now. And it's not uncommon for it to take months to fill these positions. And that's why we have started and will continue to partner with the local schools and the vocational schools to address this problem. The expanding facility in Goshen Township will offer real-life training, hands-on training that they absolutely need to prepare students for jobs in the healthcare field. Training will also be linked to all of our school-based sites, which we actually have 6 of them, and a pipeline to provide quality care. The second piece of our project is in Brown County at our Mount Orb office, which is actually along the 32 corridor. It will provide an increase in expansion from family medicine, OBGYN, behavioral health, and dental services. This also will include the partnership that we have with Western Brown Schools, which is actually our oldest school-based health and has actually been in existence for 24 years. It's the oldest one in the state. Our real goal in that one is to focus on dental care. In that community, if you do not have an emergency dental situation, it can take up to 6 months to get a dental appointment. Like our center in Claremont County, this building will also include space and offer training sites for real-life hands-on training for support roles in the medical community. So as you can see, HealthSource likes to play a wider role in supporting both our communities from an employment opportunity and from a healthcare perspective. The people of Appalachia deserve quality primary care delivered in a state-of-the-art facility, but we particularly need it for our children. HealthSource prides itself on offering nationally recognized quality of care for our patients, including all of our school-based sites. And our school-based sites are very unique because they are both school-based sites, but they are also community sites. So we both see the community and the school kids, which allow us to keep it open year-round, because I always say kids don't get sick Monday through Friday in school. So that is very unique for us, and it allows us to provide care in communities that in many times would be too small to have their own care. And our goal is to keep people healthy so that they can be productive members in the community, so that they can be good employees, and that they can be successful students. Healthcare everywhere is a cornerstone that keeps it vibrant and active communities, and HealthSource will continue to be a catalyst with these funds to move that process forward. Thank you all so much. I appreciate you being here. Now we're going to hear from the Goshen local schools.
Good morning. I'm Brian Bailey, Superintendent of Goshen Local Schools. Just want to thank you guys for allowing me to say a few words this morning. Thank you, Governor DeWine, for being here. Governor DeWine, we met 2 years back when Goshen was struck with a tornado, and we were appreciative of your care and concern then. Pleased to see you on a better occasion. Without HealthSource of Ohio's investment in our community, Goshen would be a healthcare desert. Basic medical, vision, and dental can be a drive for our families, and we know that many forego checkups because of the time and distance it takes to get there. In our school-based healthcare partnership with HealthSource, we have witnessed the value of increased quality of care. This goes not only for our students, but our staff as well. This year alone, in our school-based healthcare clinic, and these numbers are from January, I'm getting updated ones here soon, we had 250 dental exams. I know that they're doing that at the high school this week as well, so that number will increase. 274 eye exams. Out of those 274 eye exams, 74 students received glasses. 451 school-based healthcare visits by school-age patients during this school year alone, and 598 total since opening last April. Healthy kids learn better. In addition, our goal as a district is to show students multiple pathways after graduation. Many have an interest in the healthcare field, but with our geographical location, it's difficult to find opportunities that fit into the school day or into a student's ability to drive. With this dedicated space at Snyder Road location, the opportunities for our students just became a lot more attainable. Our partnership with HealthSource is vital to our district and the Goshen community's long-term success. We're excited to continue to collaborate with HealthSource and fortunate to have this valued partner right in our community. So thank you.
Good morning. I am Jen Patrick, president of the Western Brown School District. And as Kim mentioned, we are one of the longest running student-based health centers in the state of Ohio. And we've partnered with HealthSource throughout 24 years of that, and it's just incredible. I look forward to seeing how that expands the services we can provide to Brown County. And as a lifelong resident of the district and a lifelong patient at HealthSource, I just could not think of a better partnership to be had. And I'm just really excited to see care grow in our community, and I'm so thankful to the governor and for the group that have worked throughout this grant process. Thank you guys so much.
I had to travel so far to get here, like 1.25 miles. Thank you very much for choosing this site, Governor, and thank you for investing in our children. 24 years ago, I cannot believe it was 24 years ago, I was elected to the seat that I hold now. And then I went to Congress and served with the governor in Congress, and then I came back. And during that time, I learned the importance of having community-based health centers for our adults and our children. One of the things that I learned that was so astounding to me was the fact that dental care was so crucial to this area and that you could tell it when they smiled. How wonderful that Goshen and Brown County schools have the opportunity for these kids to have dental care. Vision, you mentioned the 74 glasses. Who knows better than a teacher whether a child is reading correctly or not and what the problem might be? Kid can't read because the kid can't see. Kid can't understand math because they can't see the board. Now they can. Hearing is another issue. If they can't hear correctly, they can't learn. So healthcare is a vital thread to the learning for our students. Governor, I want to thank you so very, very much for collaborating with the General Assembly on House Bill 377. I want to thank you so much for investing in our children and for the leadership that you continue to show in Ohio. God bless everybody, and God bless Ohio.